bronchiolitis obliterans. So once again, rheumatoid arthritis OLD is a bronchiolitis obliterans. So rheumatoid arthritis RLD, pulmonary fibrosis, rheumatoid arthritis with OLD obstructive lung is the bronchiolitis obliterans. The RCM NOS HS minor, RCM NOS HS equal to AM minor, amyloidosis. So once again, amyloidosis equal to RCM NOS HS minor. The scleritis and episcleritis is a red eye rheumatoid arthritis. So think about the episcleritis, the painless, and the scleritis is a painful minor, severe painful. The rheumatoid arthritis complications is one of the important hot topics for the exam, my dear. Just follow me what is written on your notes. A wide variety of extra-articular complications occur in patients with the rheumatoid arthritis. Respiratory complications include the pulmonary fibrosis, pleural effusion, pulmonary nodules, bronchiolitis obliterans, methotrexate pneumonitis, and pleurisy. Ocular manifestations, the keratoconjunctivitis (CCA) is the most common. Episcleritis, chloritis, corneal ulceration, keratitis, and steroid-induced cataracts, and chloroquine retinopathy. Osteoporosis, ischemic heart disease. Rheumatoid arthritis carries a similar risk to the type 2 diabetes mellitus and increased risk of infections and depressions. And less common are the Feltis syndrome, like the rheumatoid arthritis plus splenomegaly plus low WBC count and amyloidosis. So yes, my dear doctor, it's a very common questions for the exams, and also some of the complications related questions of the rheumatoid arthritis is very hot topic for the exam as well. I'd like to discuss onto the board so that you can be able to give the right answers correctly with confidence, my dear. So yes, my dear doctor, let's do this box here and writing the rheumatoid arthritis complications, my dear. Rheumatoid arthritis complications, if I am writing complications, I am giving a box, my dear, that is the rheumatoid arthritis RA. So you can write down the radio FM, my dear. So with this radio FM, it's a mnemonics, so that you can remember all the complications altogether. So you need to remember all these things, my dear, all together. So let me write down the radio FM, what does it mean? So the R for respiratory, my dear. So in case of rheumatoid arthritis, at least a single extra-articular complications or manifestation that you need to know, my dear, the single organ system that you need to know, definitely this is respiratory system, my dear, in rheumatoid arthritis. So a single word, the respiratory, rather than rheumatoid arthritis. So the R4 you can remember, my dear. So as I say, the respiratory complications, my dear. The next is the A for amyloidosis. I am writing the AM is a short form of the amyloidosis. You can write down the amyloidosis. Yes, my dear. And D for depression, my dear. Depression is a common form for every chronic disorders, my dear. So rheumatoid arthritis is a chronic disease of connective tissue disorders, so that leads to the depression is an essentially important part. So R for respiratory, A for amyloidosis, D for depression, radio, I for, yes my dear, I for ISD, and I for infection, my dear. And next is the O for, once again radio, the O for osteoporosis. And O for ocular complications, my dear. And next is the FM, my dear, the F for Feltis syndrome. So we can write down the Feltis syndrome, the FS, my dear. And M for the separately we're writing the methotrexate pneumonitis. What I said? The methotrexate pneumonitis, my dear. So if I'm just highlighting once again, just go with me. The R for respiratory, A for amyloidosis, D for depression, and I for infection, and ISD, O for osteoporosis, ocular, F for Feltis syndrome, and M for methotrexate, my dear. Say with me, respiratory amyloidosis, depression, infection, ISD, osteoporosis ocular, Feltis syndrome, and M for methotrexate pneumonitis. As I said, my dear, radio FM once again says for radio, single word, then you need to remember respiratory complications, my dear. So once again, quickly say with me, my dear, many times that you need to do that. Respiratory amyloidosis, depression, infection, ISD, osteoporosis ocular, and F for Feltis syndrome, and M for methotrexate pneumonitis, my dear. I'd like to talk a little bit further. So these are really important. Not only these questions are coming that which one of the following organ system is not involved in rheumatoid arthritis complications, but more detailed things that you need to know, a little bit further details that I'd like to discuss. So yes, my dear doctor, let's discuss a little bit further. So once again, the respiratory, as I said, the lungs is the next to the, if I'm saying the rheumatoid nodules, means the skin cutaneous manifestation of the rheumatoid nodules. Yes, next is the respiratory system, my dear. Lungs is the, means the respiratory system is the most important. Next is the amyloidosis, yes, my dear. All connective tissue disorders, all rheumatological disorders leading to the secondary amyloidosis, amyloid protein deposition in the different organs causing these amyloidosis features, my dear. And D for depression, as I said, the chronic disease leads to the depression. And next one, the ISD and infection, my dear. Means any chronic disease leads to immune suppressed overimmunity, but yes, there is a list to the infection, my dear. And also the ISD is really important, ischemic heart disease, because the rheumatoid arthritis is a connective tissue disorder, can cause accelerated atherosclerosis. And next is the osteoporosis. The single disease, the osteoporosis, my dear, caused by the single disease, you need to remember, rheumatoid arthritis. And we already learned the radiological features is a poor, means a periarticular osteopenia, osteoporosis, R4. Rheumatoid arthritis or Rochon, my dear, means the osteoporosis word itself is there. Means what I'm saying, my dear, osteoporosis is the single disease risk factor, that the single disease you need to remember. Secondarily, the rheumatoid arthritis. So rheumatoid arthritis is a risk factor to develop the osteoporosis on the other hand, and definitely we learned that ocular manifestations, different ocular manifestations are there. F for Feltis syndrome, and once again the MTX pneumonitis, just we put them together so that we can remember, my dear, the complications altogether. So once again, the respiratory amyloidosis, depression, ISD, infection, ocular osteoporosis, Feltis syndrome, and MTX pneumonitis. Yes, my dear doctor, I'd like to talk a little bit further discussions of the respiratory complications altogether, following what is written. And variety of respiratory problems may be seen in patients with rheumatoid arthritis, starting with the pulmonary fibrosis, pleural effusion, pulmonary nodules, bronchiolitis obliterans, complications of the drug therapy like the pneumonitis, means the methotrexate pneumonitis, pleurisy, Kaplan syndrome, massive fibrotic nodules of the occupational dust, coal dust exposure, and infection, possibly atypical, secondary to immunosuppressions. So yes, my dear doctor, listen very carefully. Among them, all them together, the single disease that you need to remember, the rheumatoid arthritis, is complicated by or affecting the lungs, the most important disease, my dear, pulmonary fibrosis. What I said? Pulmonary fibrosis, pulmonary fibrosis, pulmonary fibrosis, rheumatoid arthritis, affecting the respiratory system, the single disease, single organ, with a single complication, the total complications, the pulmonary fibrosis, my dear. So yes, my dear doctor, I'd like to give you an important box, my dear. This is really important, the respiratory complications, my dear. Yes, it is very important, my dear, for the exam. So I'd like to give you one important box that yes, my dear. So if I'm writing here, the box that the rheumatoid arthritis plus means the respiratory complications. If I'm writing, so if I'm writing the another SS box, respiratory complications, yes, my dear. It's a single disease that you need to remember, as I said, the number one, the pulmonary fibrosis, my dear. What I said? The pulmonary fibrosis. Second disease, if I'm writing, yes, my dear, the pleura. If I'm writing the pleurisy, pleural effusion, Yes, pleural effusion, pleurisy, and also infection due to immunosuppression. Due to immunosuppression means the atypical infection. The way I'm writing might just follow me, the similar patterns that you need to write down. Of course, the pleurisy, pleural effusion, and also the atypical pulmonary fibrosis. And third, we need to remember, that is very important, that is the bronchiolitis obliterans. So be like this. So I'm writing the bronchiolitis, so you can remember the bronchiolitis means all the P's, if you remember, so that will be really helpful. Yes, my dear. What I'm saying, the bronchiolitis means the bronchiolitis obliterans. If I'm writing bronchiolitis, means the bronchiolitis obliterans. Yes, my dear. And last, number 4, is a pulmonary nodules, my dear. And write down, this is Kaplan syndrome. So this is the box, my dear. So what I'm saying actually here, the respiratory complications, the another box if I'm writing here. So yes. So if I'm writing the respiratory complications, yes. Rheumatoid arthritis, the respiratory complication, all them together, I'm writing the P rule, my dear. P for pulmonary fibrosis, P for pleurisy, P for bronchiolitis obliterans, P for pulmonary nodules. As I say the single word, my dear, if I'm saying the single thing, the pulmonary fibrosis, you need to remember. When I say the rheumatoid arthritis, single word, you need to remember the pulmonary fibrosis. And other things like the pleurisy, pleural effusion, infection, means the pulmonary infection, means the pneumonia, you can say atypical pneumonia, and bronchiolitis obliterans, and pulmonary nodules. So if I'm writing the pulmonary fibrosis, and then the bronchiolitis obliterans, yes, my dear. And few things that I'd like to add, my dear, in these discussions, because from these the questions are coming, my dear. So my dear, listen very carefully. Another important box that I'm giving, this is important. If the patient presented with the rheumatoid arthritis, and on pulmonary function tests that you will learn in the chapter of respiratory system, and he found the restrictive lung defect. What I said? The restrictive lung defect, my dear. So the diagnosis, the single diagnosis, the pulmonary fibrosis. Yes, my dear. What I said? The rheumatoid arthritis with RLD, diagnosis pulmonary fibrosis. Rheumatoid arthritis RLD with diagnosis pulmonary fibrosis. Another box, my dear, I am writing rheumatoid arthritis, similarly, OLD, my dear, means the obstructive lung defect on pulmonary function test. Diagnosis, bronchiolitis obliterans. Boo, my dear. Yes. Yes, my dear. What I said? Bronchiolitis obliterans. So once again, rheumatoid arthritis OLD is bronchiolitis obliterans. So rheumatoid arthritis RLD, pulmonary fibrosis, rheumatoid arthritis with OLD, obstructive lung, to the bronchiolitis obliterans. A single tips that I'd like to add, my dear. We will learn in the respiratory system details about the COPD, means the chronic obstructive pulmonary disease, and it divided into the two diseases, my dear. That is the chronic bronchitis and emphysema, my dear. So chronic bronchitis, the word, the bronchitis. Bronchitis means the large bronchus inflammation, the bronchitis. So the small bronchus we call the bronchioles. So if the bronchioles are inflamed, so we call the bronchiolitis, and there is an obstruction after the bronchiolitis in the bronchioles that leads to the bronchiolitis obliterans. So bronchiolitis obliterans is another obstructive airway disease, my dear. The similar presentation of bronchitis, my dear. But bronchiolitis obliterans are the bronchioles, the small bronchus branches, the bronchioles obstructed, my dear. So once again, the rheumatoid arthritis, the obstructive airway pictures. So the diagnosis, bronchiolitis obliterans, my dear. That is the message, my dear. These two messages is really important. What is that, as I said? Yes, my dear. What is that? That the restrictive lung defect, pulmonary fibrosis, obstructive lung defect is a bronchiolitis obliterans. Yes, my dear. So once again, I'd like to write down, this is very much important. What is that? That is the pulmonary nodules, my dear, the Kaplan's syndrome. So if I make a box here, I'm writing the box here, SS box. If I'm writing the Kaplan's syndrome, so I'm writing the C for itself is the mnemonic. So C for cold workers pneumoconiosis. The word is a CWP, my dear. C for cold workers pneumoconiosis. So if I'm writing the cold workers pneumoconiosis. And this cold workers pneumoconiosis that leads to the massive fibrosis of the lungs, my dear, means chronic massive fibrosis. What I said? The chronic massive fibrosis. Progressive massive fibrosis means you can write on the progressive massive fibrosis. So this is very much important, my dear, to write down the cold workers pneumoconiosis. C for cold workers pneumoconiosis means the cold dust exposure leading to the cold workers pneumoconiosis and massive fibrosis. So A for rheumatoid arthritis, A for arthritis. Yes, my dear. And P for pulmonary nodules. That's it. Just remember, my dear, what I said. So C for Kaplan syndrome, the P, my dear. C for cold workers pneumoconiosis, A for arthritis, and P for pulmonary nodules. So the diagnosis is done. Yes, my dear. That is the SS box of the Kaplan syndrome. So C for cold workers pneumoconiosis. Yes, my dear. Kaplan. C for cold workers pneumoconiosis. A for arthritis with rheumatoid arthritis, and P for pulmonary nodules, my dear. Yes, that is the combinations of the Kaplan syndrome. So in a rheumatoid arthritis patients, cold workers pneumoconiosis means the cold dust exposure, and you found some of the nodules, and that is a massive fibrosis. Definitely it's a Kaplan syndrome. It's a rare, but yes, it's a possibility of the exam questions, my dear. So once again, we have the boxes, the number one box that the rheumatoid arthritis complications, the RA, radio FM, and the respiratory that we already learned, that the second important box, yes, the rheumatoid arthritis respiratory, the single word, the P, as I said, the pulmonary fibrosis that we need to learn, of course, and after that, pulmonary complications, if you write the number 3 box, that is the RA with the RLD, the pulmonary fibrosis, RA with obstructive means the BO means the bronchiolitis obliterans, and Kaplan syndrome, once again, C for cold workers with the cold dust exposure, A for arthritis, rheumatoid arthritis, and P for pulmonary nodules, my dear. And knowing these facts, my dear, it would very, very helpful, my dear, to remember some of the questions in exams is really important. Now let's get down to the A for amyloidosis. Yes, my dear. I'd like to give you another box for the amyloidosis, my dear. So if I'm writing is an important box for the amyloidosis, yes, my dear. We learned amyloidosis another chapter in hematology, but single box that you need to remember, amyloidosis, AM equal to RCM plus NOS plus HS, my dear. This is the one of the box that you need to learn. What I said, amyloidosis is equal to RCM means the restrictive cardiomyopathy, and NOS, my dear, nephrotic syndrome, and HS for hepatosplenomegaly. So say with me, because I'm just making you to acquainted with that, so that later it will not be difficult, my dear. So once again, What I'm saying? The RCM NOS HS, my dear. RCM NOS HS equal to AM, my dear, amyloidosis. So once again, amyloidosis equal to RCM NOS HS, my dear. So amyloidosis, my dear. Yes, amyloidosis. So sometimes I'm saying the amyloidosis is nothing but the M rule, my dear. What I said? AM amyloidosis equal to M rule. Why the RCM is a restrictive cardiomyopathy? So if I'm writing the M for myopathy, and nephrotic syndrome means the M for massive proteinuria, and HS for hepatosplenomegaly, I'm writing M for megaly, my dear. So in that way, we can remember the M rule of the 3M, my dear. So yes, once again, we can write down the amyloidosis is nothing but the rule of M, my dear. M for myopathy, M for massive, M for megaly. If you are not able to have this RCM NOS HS, my dear, it's more easier. RCM NOS HS, RCM NOS HS, my dear. What I say? RCM NOS HS, my dear. What I say? RCM NOS HS, my dear. RCM means restrictive cardiomyopathy, nephrotic syndrome. Once again, amyloidosis, my dear, leading to hepatosplenomegaly. So this is one of the box, my dear. The amyloidosis, you need to remember, any of the disease like the rheumatoid arthritis, SLE, any chronic rheumatological disorders that leads to the secondary amyloid protein deposition affecting the different organs like the heart, leads to the restrictive cardiomyopathy. NOS is the, yes, the glomerulus nephrotic syndrome, and liver and spleen deposition that leads to the hepatosplenomegaly. Next is the depression, as I said, the chronic depressive illness, the chronic disorders, my dear. And next is the I for ISD is important, my dear. And infection definitely because of the immunosuppression, the chronic disease, but the ISD is really important. And the box that I like to write down, my dear, this is really important. Listen very carefully. If I'm writing the accelerated atherosclerosis, SS box, yes, my dear. If I'm writing the accelerated atherosclerosis, yes, my dear. Accelerated atherosclerosis does mean that atherosclerotic process will be accelerated. Means the atherosclerosis, if needs is 10 years, after having such a disease that accelerated into the 1 year, single word, my dear, listen very carefully. The cause is the diabetes mellitus. Is the most common cause of accelerated atherosclerosis. Next to the diabetes, definitely number 2, my dear, that is the connective tissue disorders, is nothing but Ra plus SLE is the next disease, my dear. You need to remember that causing the accelerated atherosclerosis, the young patient, young females, non-diabetic but having the rheumatoid arthritis, yes, my dear, they will have the atherosclerotic disease, means the coronary artery disease, ischemic heart disease. You should think about the rheumatoid arthritis. And once again, the young females, ischemic heart disease. Think about the connective tissue disease like the SLE, my dear. So yes, this is one of the important talk, my dear, accelerated atherosclerosis. Then you need to remember the diabetes mellitus and definitely connective tissue disorder like RA and SLE, my dear. Next disease, my dear, if you say the O for osteoporosis, if I'm saying the single disease that you need to remember, definitely this is nothing but osteoporosis, my dear. Osteoporosis, single disease, rheumatoid arthritis. Osteoporosis, single disease, rheumatoid arthritis. Rheumatoid arthritis is a destructive, erosing disorder, my erosing, destructive nature. So osteoporosis is an important disease, my dear, caused by rheumatoid arthritis. So the rheumatoid arthritis, next is the ocular manifestations. Yes, my dear, this is very much important. The ocular manifestation, I would like to discuss ocular manifestations. So yes, my dear doctor, just follow me. The ocular manifestations of the rheumatoid arthritis are common with 25% of the patients having eye problems. So rheumatoid arthritis developing ocular complications, 25% cases, my dear. Ocular manifestations are the keratoconjunctivitis sicca, which is the most common, circular keratoconjunctivitis sicca, episcleritis, erythema, scleritis, erythema and pain, circular scleritis, corneal ulceration, keratitis, and iatrogenic steroid-induced cataracts and chloroquine retinopathy. Circle the steroid, circle the cataracts, circle the chloroquine, circle the retinopathy. I'd like to give one of the important box, my dear, here. That would be really helpful. So yes, my dear doctor, I'd like to give a box for the ocular manifestations or complications, my dear. So writing down this is box, rheumatoid arthritis plus ocular complications. So if I'm writing the ocular complications are nothing but C, my dear. Ocular complication is nothing but the C. So yes. So ocular complication is the C. If you're writing the C, my dear, so rule of C, that is the C for conjunctivitis sicca, we call the keratoconjunctivitis sicca. So if I'm writing conjunctivitis means we can write down the, if I write the C, keratoconjunctivitis is the sicca, is the most common complications. But the single word that you need to remember, the keratoconjunctivitis sicca is the most common. Yes, my dear, the most common. I'm writing, this is the most common, my dear. Next to the keratoconjunctivitis sicca, yes, my dear, I'm writing episcleritis. The way I'm writing, that will be helpful, my dear. Episcleritis, I'm writing the versus scleritis. The second one, if I'm writing the number 1, number 2, the episcleritis versus scleritis. And third, I'm writing, this is very much important, my dear. Yes, there is nothing but the drug induced, means the corticosteroid leading to cataract, and C for chloroquine, directly you need to remember retinopathy, chloroquine retinopathy. So what I'm saying, my dear, this is very much important. Conjunctivitis sicca is the keratoconjunctivitis sicca. Along with that, I'm just writing keratitis, C for keratitis. We can write keratitis, and that leading to corneal ulcers. So means number 1, keratoconjunctivitis sicca is the most common, and keratitis, corneal ulcers. These are the keratitis, means the cornea is involved. Second is the episcleritis versus scleritis, and corticosteroid cataract, and also chloroquine retinopathy. Yes, my dear. So I am also adding here the rule of C, as I said, by the keratoconjunctivitis sicca, episcleritis, scleritis, corticosteroid cataract, and chloroquine retinopathy, keratitis, and corneal ulcers. But the most common, as I said, yes, my dear, this is the most common conjunctivitis, means the keratoconjunctivitis sicca is the most common variety. So these are the 3 C, my dear. This is box with the RA with ocular manifestations. In your exam, it will come the first one, the keratoconjunctivitis sicca, that you need to learn, my dear. You need to give the right answers in the exams, my dear. And another important box that I'd like to write down, this is hot topic for the exam. From the ocular manifestation, I'm writing the SS box, my dear. If the rheumatoid arthritis patient comes up with the red eye, yes, my dear, that is the erythema. Yes, my dear, erythema. So you should think about the 2 important diagnoses, that is episcleritis and scleritis, my episcleritis and scleritis. Just feel it, my dear. Episcleritis just above the sclera, my dear, which is painless. There is no nerve supply. So usually episcleritis is a painless, my dear. What I said is a painless. But the scleritis in contrast is a pain. Severe pain, my dear. Scleritis, sclera is sensitive, the severe pain. The single differentiating features, the scleritis and episcleritis, the red eye, the rheumatoid arthritis. To think about the episcleritis, the painless, and the scleritis is a painful, my dear, severe painful. And sometimes a confusion. Yes, my dear, episclera just above the sclera, so it can cause some discomfort, some dull aching pain, my dear. It is mild pain. Not the severe pain. Scleritis is the severe pain, my dear. Severe pain, severe pain, severe pain is the scleritis. And also to differentiate from the episcleritis to the scleritis, I am writing another P for photophobia. Another P for pain photophobia. And I am writing discharge, means the watering of the eye, and also the vision will be affected. In contrast, these are unlikely features. All are unlikely features. Unlikely features here in case of episcleritis. So this is very important. As I said, my dear, this is important. The features are the episcleritis, the rheumatoid arthritis, the red eye, erythema, episcleritis, my dear. Episcleritis, the painless, is a severe pain, my dear. So the pain, next to the pain, photophobia, discharge, vision. PDV, if I am running the PDV, my dear. You need to remember, pain, photophobia, discharge, vision. Pain, photophobia, discharge, vision. Pain, photophobia, discharge, vision. Pain, photophobia, discharge, vision. Which is from the scleritis, my dear, not the episcleritis. So yes, this is the red, yes, my dear. It's a red eye, so the red, my dear. So all the features, the pain, photophobia, and discharge and vision will be present in scleritis, not in episcleritis. It's important, mind. It's a very hot topic for the exam to differentiate in between the episcleritis and scleritis. Very hot topic for the exam. And once again, the last talk, yes, my dear, the episcleritis, the treatment is S for scleritis and S for steroid is needed, my dear, along with some NSAIDs. But here, there is no need of steroid, usually symptomatic treatment, my dear, because the symptoms are very mild, maybe sometimes NSAIDs, but the steroid is not needed. This is very much important, my dear. So what I'm saying, my dear, this is very much important. Yes, the discussions that we are going to do, the respiratory malenosis, depression, ISD, osteoporosis, ocular, the ocular manifestations that we already done, and next is the Felty syndrome, my dear. Felty syndrome is a very hot topic for the exam. Yes, my dear, for the exams, my dear, is rare, but yes, the Felty syndrome. So I'm writing another important box for the Felty syndrome. I'm writing the Felty. The name we have changed is a Ralti, my dear. Ralti syndrome. So Felty syndrome is nothing but the Ralti syndrome. What does it mean, the Ralti? Ra, L for low WBC white cell count, and plus splenomegaly. If I'm writing the box, the Rheumatoid syndrome, so you'll be happy, my dear. The Rheumatoid is the rheumatoid arthritis. I'm writing low RLTY, that is the Rheumatoid syndrome, my dear. So Rheumatoid syndrome, rheumatoid arthritis, low WBC with the splenomegaly, yes, the Rheumatoid syndrome, my dear. Yes, so the Rheumatoid syndrome is a very hot topic for the exam as well, so that's why you need to know the Rheumatoid syndrome as well. And also the last one is the methotrexate pneumonitis, as we already discussed, that the respiratory manifestation, the pulmonary fibrosis, we can add a little bit here. The MTX means the drug-induced pneumonitis, means the MTX can cause the pulmonary fibrosis because MTX is used in rheumatoid arthritis patients as well. So that's why in added drug-induced pulmonary fibrosis. But the most important is the pulmonary fibrosis is also caused by the rheumatoid arthritis itself. The disease itself can cause a pulmonary fibrosis. So somebody talk the radio FM mic, yeah? I'd like to do once again the summary talk. Yes, my dear. This is the number 1 box, SS box, the RA complications, my dear, radio FM. Radio FM, my dear. Respiratory amyloidosis, depression, ISD infection, osteoporosis, radio, Feltis syndrome, and the M for methotrexate pneumonitis. Second important box, there is the RA respiratory complications, all the P's, my dear. You must know the P for pulmonary fibrosis, pleurisy, pneumonia, means the bronchiolitis or bronchiolitis. And of course, that the pulmonary fibrosis, you must know this is the most common. And third box, my dear, is really important. RA with RLD, the pulmonary fibrosis, RA with OLD, the bronchiolitis, obliterans is the number 4 box, my dear. And also, as I said, my dear, listen very carefully, the number 5 box here, there is a Kaplan syndrome, is nothing but the C for coal dust, my dear, remember this one. And A for, yes, arthritis rheumatoid, L for, P for pulmonary nodules. And the number 6 box, the accelerated atherosclerosis, definitely the ischemic heart disease that leads to the ischemic heart disease. Next to the diabetes, but it said that now they are compared to the diabetes mellitus, as diabetes mellitus causing the accelerated atherosclerosis, the rheumatoid arthritis and any connective disease, especially the ISLE, can cause the accelerated atherosclerosis at the same rate, my dear. Number 7, the ocular manifestation, all the CEC for keratoconjunctivitis, SICA, the most common. Sometimes exam will hears this one, that which one of the most common complications of rheumatoid arthritis, ocular manifestations, but the episcleritis and scleritis, the red eye, one of the important question, my dear, that's coming to our exam. So we put that, the episcleritis and scleritis, yes, my dear. Number 8 box, yes, how to differentiate. The painless, the painful, but the pain, PDV, I'm writing the PDV, my dear. Yes, there is a pain photophobia, once again discharge vision, pain photophobia, discharge vision are the features of scleritis, but a mild form can be happening in case of episcleritis. And once again, the scleritis, the steroid is the treatment of choice. And number 9 box is really important. There is a Feltis, the Rheumatoid is nothing but the RA with the low WBC, and splenomegaly is the treatment of choice. Means the splenomegaly is a feature, my dear, Rheumatoid syndrome. And of course, you need to remember the corticosteroid can cause the cataracts. Means the RA with cataracts, so that you can make the diagnosis, the corticosteroids. RA with retinopathy, so once again you can make the answer is nothing but the chloroquine retinopathy, the single word, my dear. The chloroquine retinopathy is the single word rather than the 2 words. Corticosteroids cataract, the CEC that you can remember, my dear. I hope that, my dear, the colorful discussions are really colorful and it will be fantastic, my dear. You'll enjoy. Thank you very much.